We're going to show you how we treat and identify kyphosis with Luce. She's going to come on the table, she's going to go face down, prone, and we're going to have the pillow underneath the hip just to maintain a little bit of a flattening around the lower back here. Good, just nice and comfortable. One of the first things we want to do is identify the thoracic spine. This is T1 and this is T12. So this is the area we're working with, and the apex would be around here, about T6, T7, T8. So what I'm going to be doing is I'm going to be gently moving the spine back and forth, looking for the area of the greatest tension. So that's not only is there a visual clue, but we can also feel the tension along the erector spinae where the most amount of resistance is. So here, for example, I can feel resistance on particularly this side here, the left side. So I'm going to just place my fingers here. How does that feel, Luce? Good.
It's tight.
It's tight. So that's the area that I want to work with. So the arms are going to be by the side. We're going to place the seat belt to snag that particular joint. So we're going to be activating these muscles in the upper back. The seat belt will be here to stop us from feeling any pressure in the lower back. Let me just find my seat belt very quickly. And we will then place this just below that T8, and we'll be putting this directly underneath. Bear with. And we'll start the active, dynamic movements to stretch the areas in the front of the thoracic spine. So the arm is by the side. Luce is externally rotating the shoulders, squeezing the shoulder blades together. She's going to breathe in through the nose, breathe out through the mouth, lifting up and holding that position for a couple of seconds, coming back down again slowly. This is the area that's doing all the work, upper erectors, and breathing out, release. Two more, up. So we're working at extending the thoracic spine. Lift up again. Now we're going to remove this, and we are going to see if that's made any difference to the tension in this area here. So let me just work on that area of T8, T9. How does that feel, Luce? A little bit less, still a little bit of tissue tension there, and then we're going to need to strengthen that. We need to stabilize this area, and I'll show you a very simple stabilization exercise that we can use directly after that stretch. So Luce is going to have her arms in front, 45-degree angle, thumbs pointing up. The heels are together to activate the glute max, which protects the lower back. And we're in this position where we're holding at this angle, 45-degree angle. The entire erector spinae is switched on, particularly around this area here where the curve is, and we want to be on there for about 15 seconds. You can do 3 sets of 15 seconds. It's a great way to stabilize the spine, to make sure the muscles are strong enough to hold you upright against the forces of gravity.